Thank you, Mr. Speaker, for giving me this opportunity for responding to questions. But first of all, I would like to take this opportunity on behalf of my constituency and as well as the ministry to congratulate Jefferson Halu for appointed as clerk of this parliament. Mr. Speaker, I thank the opposition leader and a good MP for Okilangalanga for raising these important questions, to which not only important for us to discuss and debate, but also important to inform the people of Solomon Islands. Allow me to respond to each of the 5 questions that's been raised. Mr. Speaker, on responding to question A on the total number of containers of drugs and medical supplies that was cleared from the wharf since I took office. Mr. Speaker, since I took office as the Minister of Health and Medical Services over 5 months ago, so with the support of the Prime Minister's Office, the Ministry of Finance and Treasury, Solomon Islands Ports Authority, and all the hardworking team within the ministry and as a team, we managed to release 22 full containers and 14 less container load, and early in this August. Mr. Speaker, neither I as the Minister of Health nor the ministry can do this alone, and as the ministry needed the support of all the players to action and facilitate the process that are aside of the Ministry of Health's jurisdiction. Mr. Speaker, currently there are 6 containers at the wharf. We are working closely with our line ministry, with our line partner ministry, as well as the shipping agents to have this cleared. On this note, Mr. Speaker, I would like to sincerely acknowledge the ongoing support of the Ministry of Finance and Treasury in this space in prioritizing the payment process and the support that of the shipping agent for their understanding and cooperation. Last week, MIFAL already approved them, and hopefully this year the 6 containers will be cleared. On responding to question B on the process of the total number of volume of drugs and medical supplies in those containers, and whether these are still useful and what percentage are no longer useful, Mr. Speaker, with all the containers released when I took the role as the new Minister of Health, there has been no expiry experiences as stock are quickly distributed to the provinces for use. In addition, as per previous contracts, preferred suppliers are asked to supply at least 18 months of expiry minimum, and we are looking into 3 years of expiry items as we wish to procure to avoid future expiry items reaching our health facilities. Mr. Speaker, on responding to question C on the projection for the drug supplies for the remaining second half of the year, the Ministry of Health is expecting an estimated total of 15 containers before the end of the financial year 2024. That is, it should contain the 30% of the critical items which are currently not available as they have been delayed abroad. Mr. Speaker, on responding to question D on the current method of supplying drugs to the hospital, area health centers and clinics throughout the country, and is this method still effective and efficient? Mr. Speaker, the current method of supplying drugs to the provinces is via sea freight and air freight based on the request from the provinces. National Medical Store ensures that when items do arrive, these are mobilized for distribution to further ensure that what has been requested and or needed are made available at second-level medical store. The second-level medical stores, which is in our provinces, then supplies to all other health facilities, including provincial hospitals, area health centers, rural health clinics, and nurse aid posts. That is the current model that we have practiced for the last many years. At times, the ministry coordinates with other line ministries on their vessel charters, and as such, we make use of those opportunities as well to save costs. And for instance, in previous time, the ministries had delivered its distribution through the National Disaster Management Office, NDMO, and Solomon Islands Electoral Commission on their vessel charters. While these are the current practices, Mr. Speaker, the ministry is exploring other opportunities to fast-track distribution out in the provinces and hard-to-reach areas, but also to minimize high freight costs. Mr. Speaker, we are thinking of procuring a ship that has a clinic and as well as can able to load supplies and medicine to our provinces so that this ship can able to have two purposes. Number one is to distribute medical supplies to our very far areas and as well as to provide clinical care to our rural areas. We are now dealing with its business case, and hopefully when it's ideal for us, I will take it to Cabinet and then I will inform the House. Mr. Speaker, on responding to question E on the policy action that the ministry has taken so far to prevent drugs being taken without authorization from the National Medical Store, Mr. Speaker, one of the policy actions as per the 100 days policy document is for the review and audit of the medical supplies and supply chain. While this would be a major undertaking, this work will continue at the end of August and early this month, which is September. As I speak, Mr. Speaker, with technical assistance and engagement under World Bank, a supply chain management specialist is currently reviewing the national medical store system and the processes, including the review of the end supply, review of the procurement processes, reviewing of the national medical store budget, and the review of the distribution of supplies to the second-level medical store and health facilities. The review will also include projection and estimations of the national medical store budget, considering the increase of cost of medical supplies and drugs, and also taking into account increased demand for health services and treatment. Further, the ministry, with technical support from WHO last week, also has initiated its first 3 days consultation workshop with the Ministry of Health stakeholders for the review of the national medicine policy, a policy that is aimed at fostering system to increase medicine availability, accessibility, and sustainability, and in areas of human resource, infrastructure system, and financing. Mr. Speaker, in further mitigating the risk of potential unauthorized removal of medicine at National Medical Store, the Ministry of Health has implemented various resolutions and actions, and these are as follows. Number one, with the support of the World Bank project for the expansion and improvement of the National Medical Store, the office space of all National Medical Store staff is now separate from the National Medical Store main warehouse. Before that, both the National Medical staff and National Medical Store goods and items were in the same place, Mr. Speaker. Second, based on its internal risk assessment of the National Medical Store, we have reshuffled suspected staff to the Ministry of Health for their further supervisions. Thirdly, National Medical Store has now stepped up on tightening its level of security protocols with a 24/7 security at the National Medical Stores. There is now restricted entry and access into the National Medical Store and the provisions of staff lockers to prevent personal bags entering the main warehouse. As recent as early last week, the ministry has installed CCTV within and outside of the warehouse to spot potential risks of theft. Fifth, at the National Referral Hospital, to minimize access, structural measures are being done at the pharmacy stores for limited access. Additional structural measures to separate drug storage in the National Referral Hospital wards from staff loads and changing areas will also be done in the very near future. Sixth, similar to the installation of the CCTV at the National Medical Store last week, we will extend this kind of work to the NRH's pharmacy store.